Good morning, everybody. I am here with our chamber check-in on Friday, and we are here with Don Murray, the Vice President of Marketing and Public Relations for Delta Dental. Good morning, Don.
Good morning, Paul. How are you doing today?
I'm doing great. It's a lot better when it's sunny outside and not raining.
Well, that's for sure. Look forward to a nice weekend.
Hey, so tell us how your team's doing. What's going on over at your camp?
Well, we're doing well. Obviously, the pandemic has affected all of us in new and interesting ways, and I think that we've been kind of maintaining our way through it and making sure that Idahoans are getting the best access to oral health coverage that they can.
Okay. How's your team doing? How are we working? Are we working from home? Are we working at the office? What's going on there?
Well, we're working primarily from home. We needed to create the social distancing measures and make sure that our employees feel as safe as they need to with their various different situations and life situations. We were, like many companies, I think, shocked to realize how effective and efficient we can work from home, so that's worked out really well for us. As you can see, I am working from home today as well. But it's worked out well, and people are doing well. We have little my specific sales team and we have coffee talk meetings a couple times on Zoom each week, and those have gone well. And I think everyone's got a little bit of cabin fever, but finding our way around that as best we can.
Okay, good. So, Don, why don't you tell the audience that's listening today a little bit more about Delta Dental? How does it help its employers and providers? Kind of give us a quick 30,000-foot view of what Delta Dental is.
Okay, Paul. Yeah, happy to. Well, Delta Dental is a brand that many people are familiar with, and part of the reason for that is that it is a national brand. There are 39 different Delta Dental member companies that belong to an association. And those companies are independent of each other, but we share the same brand, and we do talk from time to time as appropriate. Delta, if you look at it from a nationwide perspective, we serve over 80 million people
Wow.
with their dental benefits. And so it's a big business, and it should be, because after medical insurance, dental is the next most important insurance. In Idaho, we have over 400,000 members. Idaho is a state that, when compared to other states nationally, actually does fairly well in terms of how many of our Idahoans have access to some form of dental coverage. We're a few percentage points higher than the national average, and that's good if you consider the fact that we are giving our people access in the state. But it's also a little frustrating, because dental is one of those things where I coined a term a couple years back. I call it oral apathy. Dental is something that we have access to through our employment, or sometimes if we're purchasing individual policies, but it's not something that everyone uses as often as they should. Sometimes people don't go to the dentist. They either get busy in their life or their work, and they can't put it together, and they don't think it's important enough. But part of what we do in our focus on oral health is we make sure that we advocate as best we can how important oral health is. It really is important. You're not just keeping your teeth clean and making sure you have a nice smile in your life and in your business, but it's also important from a medical perspective, because there's a lot of connections between how healthy your mouth is and how healthy the rest of your body is.
Okay. Well, hey, I just spent a little time with my dentist this week, and it was just interesting. I didn't have any issues walking into the office and seeing my dentist. Tell us a little bit about what people should be expecting going back to see their dentist.
It's a little bit different now with the pandemic. But fortunately, after a couple months of largely being closed, our dental offices across the state are back open again and really ready for normal business. And a lot of people are going in and getting caught up on having their teeth cleaned, et cetera. The experience is different, though. I went to the dentist as well recently, and now what happens is that you're often asked not to go and wait in the waiting room, but to keep that social distancing. So a lot of the time you're having your appointment set, you'll kind of wait in the car a few minutes, then they'll call you in, they'll check you in. There will be a lot more personal protective equipment that will be visible, masks and face guards, and a lot of cleaning and sanitizing, more so than what we visibly were aware of in the past. But it's important to note that with all these safeguards in place and the practical reality of what happens when you go see the dentist, it's an extremely safe experience with respect to the pandemic. So I would hope that people aren't hesitating or concerned about that, because the dental offices across the state have paid very close attention to making the adjustments, like any business has in the state, about what they need to do to be safe.
Okay, cool. Hey, I'd also like to have you tell the audience, I heard a little bit about teledental. And I thought that was just interesting, to say the least. Can you expand on what that might be?
Well, telemedicine has been receiving quite a bit of more awareness has been generated around what can be done through telemedicine, and there's also a concept of teledentistry that is similar in that, if you think about it practically, there's only so many things that can be done through teledental technology. It's
Yeah.
Teledentistry could be as simple as me holding my iPhone up to my mouth and saying,
Oh
my tooth is kind of sore, and it looks like I might have cracked it or something like that. It's a little controversial as well, because what's important in good oral health practices is what the American Dental Association advocates, as far as how dentists should conduct their practices and what they can and can't do. And there are limitations of what really can be done to proper standards through teledentistry. So I would say that the best way to characterize it right now is that the industry is kind of feeling their way through it. During the worst period of the pandemic, when the state shut down initially, like in March and April, what was happening is that people were still going to the dentist for emergencies during that period of time. They just weren't going in for their checkups. Right. And so dental offices, would be open for that purpose. And there could be some situations where, they could do some sort of assertion or diagnosis of whether or not it was important for that person to come in. And so that's how they used it.
Well, it's so important just to get back to the basics here. Go see your doc, go get your checkup, go get your teeth cleaned, stay on top of that, because you don't need all that insurgence after, let's say, all these things there's a vaccine and everybody gets back to work 100%. And then, oh my gosh, everybody wants to go to the dentist at the same time. Everybody needs to go to go get their checkups at the same time. So
yeah.
If you're out there, make an appointment with your dentist. Don't put it off. Take care of the basics. Back to the fundamentals.
Yeah, I would echo that, Paul. It is important that people, feel comfortable to go get the care that they need and try to keep to the schedule. One of the, there were a lot of adjustments during the pandemic, and still they are in place today, that we did in order to complement our dentists and what they do as far as their profession, but also our members and our employer groups and all of our customers. We got a lot more flexible during this period of time, because we wanted to make sure that a lot of these folks that were perhaps being furloughed or laid off, or if groups got into trouble, just as far as surviving the pandemic, we increased a lot of ways that we are flexible and to support our customers. One of the changes that we recently announced, for instance, is that normally in dental insurance, you will be able to go get 2 checkups. It's standard to have 2 dental checkups a year, and they were separated kind of by 6 months. But what we've done is we've allowed, the 2-month pandemic hiatus kind of put this the sequencing of when people would go and get those checkups. It was off now, and so we recently said, well, now you can have 2 in a year. You don't have to worry about whether one happens every 6 months, et cetera. So those are the sorts of things that are happening industry wide, and I guess the other thing to call out is that during a period of time when people weren't going to the dentist and the dental offices were closed for normal business, of course, the claims were decreasing dramatically. People weren't going to get the services. And so, we've made a commitment to our customers in our marketplace that just because we're not paying out those claims for a couple months, we're not going to profit as an organization in any way from the pandemic. We're looking for and finding ways of making sure that those dollars are returned back into our customers' systems so that we can exit this pandemic when that eventually happens in a very normal sense, and people will be protected in that way.
I did see an email from your president, Greg Donaka, on kind of the explanation of the added benefits and the extended benefits as well for the end of the year if you weren't able to get some work done. So that's great.
Yeah, and on that note, I'd like to offer one additional thought. Before the pandemic set in, we had just in 2019 rolled out a really innovative and unique program for our customers that allows dental care to be even more customizable to an individual's needs than what formerly was the case with typical dental prepaid benefits. And what that program is called is HOW. It's an acronym for Health Through Oral Wellness, HOW. And what's kind of neat about HOW, and most of our customers in the state now have access to this, and many of the dentists, not all of them yet, because it takes a while to roll that out, but most of the dentists are supporting it as well. And what HOW means is that if you're a Delta Dental of Idaho customer, you can go to your dentist now, and they will conduct a oral health wellness assessment. It's called Provisor, and they'll assess what category you as an individual fit into how well your oral health is. Most people don't know it, but almost 50% of the population, all of us, have some level of periodontal disease, gum disease. That's because we don't really brush and floss as well and as much as we should. And so that's the oral apathy I was referring to earlier. What HOW does is it allows the dentist and their customer or their patient to make that assessment, understand where that individual is, and then it automatically with us kicks in for additional services that they may benefit from in order to get them to a higher state of better oral health. And so that can become a part of the practice pattern and all with the dentist and their member customer or their patient. So it's really a pretty cool program. It's something that some of the other Delta Dental member companies are also doing across the country, and we're really excited about what it does for all the people that we serve.
That's great. Hey, I just want to let the audience know as well before we sign off today, Don, that Delta Dental has been a member of the Chamber since 1984. So thanks for your investment in the community. And why don't you tell us a little bit about that community involvement? Expand on how you guys contribute to this region.
Well, thank you for that opportunity, Paul, because that's a really important part of what we do. We're a not-for-profit company. We really consider it extremely important in terms of how we reach out to our community. And there's a lot of folks in Idaho who don't have access for any number of different reasons to good oral health care. So for years, we've had programs like Grins on the Go. Some folks in the audience may have seen our vans or our pickup truck around town or around the state because it's a statewide program. And Grins on the Go is a program where we reach out to children in secondary school who don't have access through either their parents or through other vehicles to get oral health care. And so we have dental hygienists who go out on site and will perform a lot of those oral care services for these kids. We also have another program in our community outreach that services elderly constituents who also don't have access. Maybe they're in the Alice gap between Medicaid and Medicare, and we've had those programs going on for quite a few years. We expend more than $1 million a year committed to them over time. We're now probably approaching 12 million and the investment, and so a lot of people aren't aware that we're just not a traditional dental benefits company. We also have a lot of community outreach and engagement that we feel very strongly about and support.
Awesome. Well, Don, happy Friday, my friend. It's so good to talk to you.
Well, it's always great talking to you as well. And we appreciate the opportunity to be on a Chamber Check-In. Thank you very much for that.
Awesome. It's my pleasure. Again, hey, thanks again for your time. Thanks for your investment in the community. Thanks for your membership with us. And we'll talk soon. Have a great weekend, Don.
Thank you, Paul. Bye-bye, everyone.